Whoa, that's insane. Welcome back to Digital Physio. My name is Leon. Today we're going through Neymar's latest Instagram update about his recovery and rehabilitation from his latest ACL reconstruction and meniscus repair. If you haven't watched my previous video, the video is here. I'd recommend watching it. It just puts into context behind what happened to Neymar and how he got to this stage, as well as the early stages of his recovery from his knee surgery. Now, before we get into it, I'd highly appreciate if you can like and subscribe this video. This allows us to continue delivering high quality free educational content about everything that relates from health, well-being, all the way to injury management and longevity. So now we'll be reacting to Neymar's latest Instagram video, which showcases his current progression in his journey towards recovering from his latest knee surgery. Let's get into it now. Okay, so what you can see here immediately, there are two things that are standing out to me. The first thing are the crutches. It's very common for anyone after knee surgery, whether it's ACL reconstruction, whether it's a knee replacement, to be using crutches for a period of time to reduce the weight bearing through the knee and allow that surgical area to recover and heal. Now, the second thing that's quite interesting that stands out in Neymar's situation is that he's wearing a knee brace. Now, Neymar here isn't just wearing any ordinary brace. He's wearing what's called a hinged knee brace. This is a brace that can be adjusted and set in a way where it restricts how much your knee can bend for a certain amount of degrees. So initially, you may only be able to bend, say, 30 degrees before the surgeon loosens up on the restrictions and allows the knee to bend a bit more as you're walking. As you can see here, Neymar is looking very stiff at the moment. So obviously his hinge knee brace has been set for a low degree of bend. And this is indicative that it's still early stages into his rehabilitation and recovery. Now, it's important to understand that this isn't always necessarily the case. Every surgeon has a different protocols. Every patient has the different needs and requirements. Some surgeons prefer to have someone in a brace right after ACL reconstruction only. It really depends. So a protocol I found here has recommended patients after knee reco to wear a knee brace, whereas a protocol that I've found here has recommended patients only undergoing a meniscus repair alongside the ACL reconstruction requiring a knee brace. So every situation is different. Every surgeon is different. And from my experiences, patients requiring to wear a knee brace will do so when they've had something else done alongside the ACL repair. Yeah, as you can see, he's walking down very stiffly with that knee, and that hinge knee brace that's restricting his ability to move properly or bend his knee properly at the moment. A common question that a lot of patients will ask me when they're on crutches is, how do I get up and down stairs? And there's a simple way to remember that. It's good leg up to heaven, bad leg down to hell. So when you want to go downstairs, it's going to be crutches, bad leg, good leg. Going upstairs, it's good leg, bad leg, followed by crutches. So for all those watching right now and are using crutches, that's a nifty little tidbit for you to take away today. After significant knee surgery like an ACL reconstruction and a meniscus repair, the surgeon usually requires the patient to go towards a rehab therapist, namely a physiotherapist, to look after rehabilitation, where they provide them with exercise they can do to meet certain milestones, as well as education about what they should expect and what they should be doing in order for them to optimize recovery and rehabilitation. What it looks like the physio is doing here at the moment is assessing Neymar's range of motion. So one of the milestones for patients to achieve after surgery is trying to get as much bend and straightening as possible. In this case, they're probably looking at how far he can take his knee in terms of his bend or knee flexion. One pretty notable thing is that there seems to be a lot of muscle wastage along Neymar's thigh and calf muscles when you compare it to the left-hand side. So another major goal after an ACL reconstruction or a meniscus repair is building up the muscles around the knee. So the quads, the hamstrings, the calf muscles are extremely important to try and achieve that activation, strength, and control within that early phase right after surgery. That is pretty crazy. Geez. I mean, as a healthcare practitioner, as a physiotherapist, the first thing we're told is to first do no harm. And these guys are clearly violating that principle right now. Neymar is clearly not happy. He's whimpering. He's screaming out. It is completely not necessary to be doing this type of treatment this early on in his recovery. I mean, he's had his surgery on the 3rd of November. This video, was released a couple of days ago, which means that it's no more than 8 weeks post-op, and we do not need to be doing these type of treatments this early on. The priority is letting the knee settle, then the inflammation and swelling drop, helping the patient manage their pain, and then working on the range of motion as they can tolerate, and not pushing them to the end range of motion at this stage. In fact, what's probably more important is trying to get the knee straightening rather than the bending at this stage, as well as the quads activated. This can be worked on later down the process once the knee is less angry. So I don't understand why they need to be so aggressive with the treatment so early on in the process. So they've brought a world-class athlete into tears. I mean, this guy is probably not averse to pain and suffering and coming through adversity. So for them to be doing that, it is completely unnecessary. And don't just take my word for it. Plenty of healthcare practitioners, like physiotherapists and surgeons, will probably agree that there are many other goals to look into rather than trying to get the knee bending as much as possible. So one document that I think will be great if you're someone that's had a reconstruction or looking to get a reconstruction is the Melbourne ACL Rehab Guidelines. These highlight step by step the milestones you want to achieve after surgery in order to get you back playing sport again. So if we look at phase 1, recovery from surgery, the milestones that you want to try and achieve in the first several weeks, a month, 2 months after surgery is 4 things. You want to try and get the knee as straight as possible. So try and get passive extension to 0 degrees. Try and get the knee bent past 125 degrees. Try and reduce swelling as much as you can. And the 4th milestone, get the quads activated. There are so many things you could be doing in this early stage, and these guys are just focusing on the bend. I do not understand why they're putting this patient through so much agony and pain where there are other things they could be working and focusing on. It just doesn't make sense to me. And the fact that he's wearing a hinged knee brace tells me that the surgeon wants him to be protected from entering certain ranges of knee flexion, and yet they're still continuing to push. So it's just bizarre about what's going on at the moment. You'd think that an athlete like Neymar would have the best possible medical care in the world, and clearly he's got Three Stooges jumping on him, trying to torture him. It's just completely bizarre about what's going on at the moment. Whoa, that's insane. So I'm speechless right now. How many guys does it take to bend a bloke's knee? In this case, 3. So clearly they're trying to get as much bend out of this guy's knee as much as possible. I can't comment to say whether or not what they're doing is in accordance to what they should be doing. Typically, after surgery, a surgeon will have a protocol about what the physiotherapist should be working on trying to achieve at a certain time frame after surgery. But if we look at, other rehab protocols, I'll put some examples down. If we look at this guideline here, it says that you want to try to achieve passive and active assisted and active range of motion exercises aiming to achieve full extension early. So getting the knee straight is the most important thing in the early stage, and then full flexion by 8 weeks. So in this protocol, they've got 8 weeks to achieve full bending of the knee. And Neymar's had his surgery done on the 3rd of November. And this video has come out one day ago, says it has not even been 8 weeks yet, and they're trying to force it this much at this stage. And if you even look at the early stages, they've emphasized that minimizing swelling over the first few days is very important. And what they're doing is counterintuitive to that early goal of trying to protect the knee and allow the swelling to settle. Now, a second ACL recovery rehab protocol that I found from the St. Louis University, which is an American institution, they've outlined their milestones at a specific time frame as well. And you can see that they want you to try and get a knee flexion within 10 degrees of the other side by 3 to 5 weeks, and full flexion by 6 to 8 weeks. So once again, we're looking at that 3 to 8 week mark before we try and get full flexion of the knee. And they're just pushing way too hard at this time and point. It definitely isn't 8 weeks post-op, and they are pushing within the boundaries of pain and causing potentially more harm to the knee and the graft more so than anything else at this time and point. Once again, I don't have the rehab protocol from your surgeon, Rodrigo Lasmar, so I don't know what they're doing is conventional or recommended by the surgeon, but visually and from what I'm seeing from other protocols from other surgeons and recommendations from other experts, what they're doing is too much at this time and point. If I could use one word to describe Neymar's current rehabilitation journey after his ACL reconstruction, it would be unconventional. In the first video, when we talked about his early stages of recovery and rehabilitation, we saw him use a contraption that was not very conventional, a CPM machine, and that's okay. In this recent update on his Instagram video, it's almost nearing a breach in a healthcare practitioner's duties. And one of the principles that we learn as healthcare practitioners is first to do no harm. And from my point of view and many other physiotherapists' point of view, it seems like they're encroaching upon that principle. In the early stages, it's important for us as rehabilitation professionals to respect what the patient's gone through. They've had major surgery in the knee, and that's still recovering, still inflamed, and they're sore. And we need to respect that. These type of injuries need to be taken seriously because they're athletes who've had their careers never the same afterwards. One prominent example would be Derrick Rose, once an MVP level caliber player. After his ACL injury, was never the same player ever again. So all we can do is just wait and see what's going on with Neymar. Perhaps some of this is just a bit dramatized and he's just really going through conventional treatment. Or perhaps this is what he's going through every day, screaming, yelling, kicking, having 3 grown men try and forcibly bend his knees far back as they can without respecting his boundaries of pain. In saying that, it's hard to judge what's going on. We don't have the rehab protocols in front of us. What they're doing now may be what the surgeon wants them to do. We do not know. But the physiotherapy world has reacted quite perplexed. One of the big organizations, Physio Network, they've released a LinkedIn post, and you could see that many physiotherapists were quite confused and somewhat outraged about what's going on. Another prominent figure in the physiotherapy space, Adam Meekins, also released an Instagram video criticizing what was going on as well.
Clearly, Neymar is in a lot of pain and in a lot of distress there. And I don't speak Portuguese, but I actually think he is asking them at a number of times to stop, and they still carry on. This is just totally unethical, unprofessional treatment of any patient with any problem in any situation.
It'll be interesting to see what goes on in the next couple of updates that we see from Neymar. I hope things become a bit more conventional, and I hope he's doing well. And that is it from my end. I'll be continuing providing you with more videos about what's going on with Neymar's rehabilitation and recovery as he continues to provide us updates on his Instagram videos and reels. I would greatly appreciate if you could subscribe to this channel and like this video. It just gives us a bit more freedom to be able to provide you with ongoing free content about all things pain, injury management, health, and longevity. So for now, we'll say our farewells, but I'll see you very soon.